name is Shauna Perez. I'm a master's student. I'm working on my degree in health and rehabilitation sciences. And I'm also a service provider that works with people experiencing homelessness, mental health, and addictions in the Kingston area. I just completed a scoping review recently. The scoping review was on moral distress experienced by service providers working with people experiencing homelessness. There was about 40 articles included in it, and it was published with the Journal of Mental Health. Our findings showed that, people working with service providers working with people experiencing homelessness are experiencing moral distress as they work to help people. Part of what I thought was interesting about the findings is it's like the constraints to helping are what are contributing to moral distress. And the helping is like, it's an interesting thing for service providers working with people experiencing homelessness, because their job is literally to help. But helping is also part of our identity. It's like something we want to do. It's like, so people working in this field, like morally, they want to help people, but it's also their job to help people. And what does it do to a person when you're not able to do your job or your moral duty? And what our findings showed is that there's an insurmountable constraints that prevent service providers from helping people experiencing homelessness, and that can look like, societal constraints, like in relation to laws that prohibit people from, trying to get money or standing in certain places, or even like putting up a tent somewhere. It could look like, organizational barriers that prevent the service provider from helping. It could look like, structural barriers, such as like there's not enough housing, and we have a lot of people whose job is literally to find housing, but they can't find housing because there's no housing. There's also not affordable housing. So like what I found interesting is like what that does to a person when their job is helping and they're very motivated to help, but there's so many things that are stopping them from helping. And another interesting finding was that people aren't just experiencing moral distress, like they're experiencing trauma, they're experiencing burnout, they're experiencing like anxiety and other mental health conditions that are directly related to their job and their role as a professional. So like it's not, and when in relation to the moral distress that they're feeling, it's not just like one instance of moral distress. It's repeated occurrences of moral distress that are happening over and over again. And people, like service providers, are suffering mentally from that. Like they're not okay. And that was actually one of the themes that came out of the scoping review is like, we're doing the best we can, but there's so many barriers. And then we're not okay because of all these barriers. And like, out of the 40 articles that we had, like each article had multiple mental health conditions or issues that the service provider was facing. So it could be like a psychological, experiencing psychological distress. It could be like stressors. It could be burnout, compassion fatigue, vicarious trauma. Lots of articles talked about like trauma that service providers were experiencing in their roles. So this is like, so our service providers need help. Like in this field, the constraints are causing harm. I consider that like service providers are human beings, and they're also working with people who are suffering, like everyday suffering, and there's no way to alleviate that suffering. You're just like, as a provider, you're forced to witness the suffering of other people, and that is awful. It's awful for someone to have to experience that and know what the right thing to do is, but be constrained from being able to help that person in the way that they wish that they could help. Like that takes a mental toll on people. It just piles on and it takes a toll. And, it's very easy to be traumatized by the events that you're witnessing, but also vicariously traumatized by the things that you're hearing about. And service providers need more mental health support. Like for sure, like there's a lot of things that service providers are experiencing, just even going to someone's camp and seeing like the state of depravity that they're living in, even just like all the health concerns that someone might have and having to witness that, witness a person like slowly deteriorate and not being able to do anything about that. Like that would mentally harm anybody.